Hello, I am urologist Omer Erdem. Today, we will discuss the topic of sexual lubricants. What are sexual lubricants, what are they used for, how important are they, and are there any risks? We will address these topics. We see many patients in our clinic who have difficulty due to vaginal dryness, where the man cannot enter the vagina despite being erect, or as a result of forcing, there can be tearing, swelling, redness complaints on the penis and vaginal wall tears, and bleeding in women. I have encountered this situation frequently and still continue to see it. In some women, there can be less moisture in the vagina, or there can be dryness in the vagina during and after menopause. There can be dryness in the vagina due to many reasons. In this case, sexual lubricants come into play and save the sexual intercourse. Because lubrication is essential during sexual intercourse. When there is friction, problems such as pain and discomfort can occur. Partners usually cannot tell each other about this. For example, the female partner may not be able to tell her partner, or the male partner may also feel pain or discomfort. In such situations, there can be loss of sex drive in both men and women for the next sexual intercourse. Therefore, with sexual lubricants, you can have a more natural intercourse and increased pleasure, and therefore, sexual lubricants can be very important in some couples' sexual intercourse. How many types of lubricants are there? Water-based, silicone-based, oil-based, and natural lubricants. Water-based lubricants are more quickly removed and can evaporate from where they are applied. You may need to apply them several times during intercourse, and they do not dirty the bed sheets. Those sold on the internet and in pharmacies are usually water-based. In addition, silicone-based lubricants are also available, but they are less popular. Also, oil-based lubricants and natural vaginal lubricants such as olive oil and coconut oil are available, but oil-based ones can harm condoms and disrupt their structure. A small anecdote: some lubricants contain glycerin, which can increase the risk of vaginal bacterial infection. Therefore, as a recommendation of the World Health Organization, lubricants with a pH level between 3.5 and 4.5 and an ozone value below 1200 should be preferred. Lubricants with a pH level between 3.5 and 4.5 and an ozone value below 1200 are better. Vaginal lubricants should not be confused with vaginal moisturizers. Vaginal moisturizers generally contain hyaluronic acid or estrogen hormones, and when used regularly, they maintain the vaginal moisture balance or keep it wet, protecting the vaginal structure. Vaginal lubricants, on the other hand, are used just before sexual intercourse. Vaginal dryness can cause discomfort during sexual intercourse. Therefore, if any dryness problem is expected, using a lubricant is recommended. The right lubricant provides comfort during intercourse and increases pleasure. Thank you for listening. Best regards.